We are waiting for our guest speakers. The event will commence shortly. Sorry for the delay.
Very good evening to everyone present here today. I am extremely sorry for the delay caused. I would now like to invite Interactor Abizar Zohair, Interactor Moez Mansoor Ali, and Interactor Huzefa Ali Asgar to recite the Pledge of Allegiance, the Interact Invocation, and the Rotary four-way tests.
Please raise your left hand. I salute the national flag of Sri Lanka, which signifies the independence of my country, and stand for all its people, united as one nation. I pledge allegiance to Sri Lanka and undertake to work towards its peace and prosperity in the spirit of tolerance and love. Thank you.
Instill in us, O Lord, the true meaning of friendship. Never let us forget that we are thy children. That the differences of cultures and creeds should not matter. Endow us with the desire to serve our fellow men, remembering that we too often need help. At all times, when the need for service arises, caring to make our badge of interact worthwhile, tell us that we have not lived in vain.
The four-way test of the things we think, say, or do. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned?
Thank you, Interactor Huzefa, Interactor Abizar, and Interactor Moez. I would now like to call upon our President, Interactor Rashida Juzer, to give away the welcome address.
Thank you, Khadija. Honorable dignitaries, guest speakers, multiple Paul Harris Fellow Rotarian Dr. Rohantha and Rtn, past District Governor Rotarian Dushan Soza, Dr. Burhani Hamza, Principal Dr. Sheikh Shabir Hussain, our staff advisor, Ms. Rashida Abdul Hussain, and last but not least to all those present here today. I want to welcome you all to the first phase of Project Apart Together. The hesitation towards vaccination with the COVID-19 vaccine remains a problem worldwide. His Holiness Dr. Serendib Saifuddin has always advocated and encouraged us to abide by our country's rules and regulations, and has been advising us to get vaccinated as soon as possible. He also made sure that our community actively participates in vaccination drives to make sure they are carried out smoothly. Hence, following our Mola's teachings, the Interact Lab of Burhani Serendib School has organized this project with the aim of educating people on the COVID-19 vaccination. I hope that through this event, people are more informed and eager to take the vaccination, and I hope that we succeed in achieving this aim. Thank you.
Thank you, Interactor Rashida. Our first speaker for the day is Dr. Burhanuddin Hamza. His work experience is at Bambalapitiya Base Hospital as a surgical resident doctor. He completed his education at Witebsk University, Witebsk State Medical University. Dr. Burhanuddin is currently a medical officer in the COVID treatment unit at Columbus South Teaching Hospital, resident at Bambalapitiya Base Hospital as a senior medical education consultant and a lecturer at IMC. The floor is all yours, sir.
Hello, everyone. Can I share my screen?
Yes, sir.
Can you guys see my screen?
Yes.
Yes? Okay, right. Bismillahirrahmanirrahim. First of all, I think as Rashida had actually informed me, this session was mostly going to be about vaccines that are out there, right? But let me just give you all an introduction. I'm sure you all know this has been there since 2019. It has affected all our lives. It has affected our daily lives. It has affected every part of what we do. So basically, for us to understand what the coronavirus is, this is very, very important, right? What exactly is a coronavirus, right? So the most important thing I would want to emphasize, the reason it gets its name because of its crown shape, right? One part which creates protein spikes that you actually get on the outer covering, that is very, very fundamental in deciding how you actually make vaccines, right? So I'm sure all of you all know, you all have had a lot of people who have got infected with COVID-19, right? So the basic symptoms, you get respiratory symptoms and gastrointestinal symptoms. So respiratory symptoms are like, it can either be a common cold, you can have a sore throat, cough, a blocked nose or a runny nose, you might have an associated feature where we had this thing, patients would say that, everything smells and tastes like soap. And that would last for around 3 to 4 weeks, even after recovering from COVID-19. The Delta variant is a little different. I'll be talking about the variants because before understanding what these vaccines can do. So the difference is that if it's mild or moderate, it'll cause something. And if it is very serious, it can actually go and infect your lungs. The Delta variant also causes these symptoms where patients would also complain of diarrhea, loose stools for a few days, and then they start developing a fever. A very important thing, right, with regard to this particular virus, right, the coronavirus, this is not something that has come out of the blue. With such a thing in the past, I'm sure you all know what SARS-CoV, the actual SARS, which was the severe acute respiratory syndrome, which was there in China in 2003, was something again caused by coronavirus. We had something called MERS, which is the Middle Eastern Respiratory Syndrome coronavirus, which was something in Saudi Arabia. The difference, they did not mutate the way SARS-CoV-2 mutates. That's the biggest problem here. That is the biggest challenge that we are having right now with this particular virus, right? So I'm sure a lot of you all, I have a lot of people who keep asking me how many variants are there, what is these different concern versus variants of interest. Variants of interest are those two. These two, let's look at what a variant is. Now you see that there is a coronavirus and there is a basic coronavirus, and these viruses, right, because we are trying to battle with them, they keep adapting to this environment. In other words, they keep mutating, right? They try to get stronger. We are attacking them using different sort of antivirals and all these other things. Our immune system is also fighting back, right? So the process in which the virus mutates is what develops into these different sorts of variants, right? So there are some variants which are of major concern, right? And there are some variants which we still do not know and have not become such a problematic sort of variant, right? So the variants of concern, I mean, WHO has categorized 4 important variants of concern. There is the alpha variant, which is actually the B117, which was the UK lineage, right? We had the beta variant, which was from South Africa, right? Which is something which has actually been contained, but still is there, right? A lot of studies, I do because now look, this particular topic is very new, and there's so many different statistics and so many different researchers carried out by a lot of different organizations, can be NGOs, all of these organizations. So the beta variant, a lot of, I mean, I don't know if you all remember, South Africa declined all their Oxford AstraZeneca vaccines because their research concluded that the beta variant, the Oxford AstraZeneca is not at all effective against the beta variant, right? So again, it's a debatable topic. So that is the beta variant. Then you had the gamma variant, which is the P1, which is from Brazil, right? And now what we are dealing with in Sri Lanka, and I think which started from India and how it has come to Sri Lanka, is the Delta variant. Now, considering all these variants of concern, Delta variant is very transmissive. What I mean by transmissive is it infects more people as compared to all the other variants combined, right? So that is what is so dangerous about this virus. Earlier, if you were in a room with someone who was infected, right? If you were wearing a mask, right? If you're wearing your proper mask, probability of you getting infected, and you stayed in that room for less than 10 minutes, the probability of you getting infected if you did not have be 0.01 around 2 to 3%, right? So that is the reason I use this percentage, is to show you how important masks are. I know this particular topic, this session is about vaccines, but there is a lot of emphasis on all the other things. Just because you get vaccinated does not mean that, eventually, yes, we can stop wearing masks, but masks are as useful as vaccines are, right? So those are the 4 variants, and that is why we have seen the third wave that has actually, increased the number of cases that we actually developing and the number of deaths, right? So moving on, right? So for us to understand what exactly, the situation in our country, to look at it in a statistical point of view, this was actually from 31st of August 2021, right? We've got a total number of 445,027 number of cases. Mind you, I'm sure you all know there are so many patients who don't get themselves tested, right? So this is without that law. And that number is still not known, right? But it is suspected that there is at least another 35,000 individuals who have already got COVID-19 and got treated by themselves, right? Either by being home quarantined or without getting themselves tested, right? From this particular lot, 9,185 COVID deaths have been seen, right? So you can also see on a comparison, the first wave, the second wave, and the third wave, right? So the third wave is the current wave that we are dealing with, right? And the reason, I mean, why there is such an emphasis and why I speak about the Delta variant, you can see a drastic increase regard to this third wave. That's because of the potential. Very important thing is we've got quite a lot of individuals vaccinated. We've got, as you can see, there is quite a number of individuals that are vaccinated out here, right? So let's move on to the deaths, right? The deaths that are confirmed, right? So when you look at the deaths, right? So a lot of people keep asking why people, I mean, if a person is fully vaccinated, what's the problem? Why does he get a serious infection? Why does he need an HDU setup sort a bed, right? So there are a lot of different reasons as to why some vaccines can not give the best sort of immunity as compared to not someone who develops a good immunity. The reason is other medical problems, right? So if a person is having hypertension, if the person is having diabetes, if the person has got a bypass done, if the person has had bronchial asthma, then there is a higher likelihood. So the vaccine alone is not going to help that particular person. But remember, when I said these things, if I said that all these medical conditions put you at a higher risk, right? A lot of patients get scared when they say, okay,
Um,
you practice the safety measures that have been stipulated by the health ministry, do your medical condition seriously, taking your necessary medication, right? And you are checking up, you're checking your sugar. If all of those things are done, brilliant, you don't have to worry about it. But the problem of concern is this age group that you see, the from 0 to 29, right? There is a lot of patients that we have, even at Kaluboville at the moment in the MICU, we have 5 beds, and all those 5 patients sadly are less than 40 years old, right? The reason being some of them have medical conditions, long-term steroids for other vaccinated. And I think that is the emphasis out here, right? If you look at the vaccination schedule, I mean, the vaccines that have been given in Sri Lanka, you have the AstraZeneca, which is the Covishield, Sinopharm, which is the one that is abundantly being given, right? You have
Dr. Burhani, your Wi-Fi connection is unstable, so you're lagging for all of us.
Good evening, everyone. Extremely sorry for the delay. Dr. Burhanuddin will be right back with us. Please bear with us until we figure out the technical difficulties. Thank you.
I hope now it gets sorted. It was good that my cousin actually helped me out. Very, very sorry for the right. I hope is the connection clear?
Yes.
Right. Okay. All right. So I'm gonna start again at what I wanted to emphasize. When you look at the data that actually you can see out here, right? When you look at the vaccination status, amount of people who have been vaccinated versus the people who are unvaccinated, especially the ones who have been vaccinated and who have passed away, and the people who have not been vaccinated and who have passed away due to COVID-19. Right. So statistically, right, you can see that 2% of all the deaths have been patients who have been patients who have got vaccinated with the vaccinated, and they've still succumbed. And the reason to that is most I think if you take that 2%, from that 2%, it's around 1.2% of the patients had other medical conditions. They had medical comorbidities that actually, it was not controlled. Due to that reason was the reason. I mean, we could say that they did not have much of a chance, right? So this particular statistic clearly shows that vaccines do help us and do help people from getting it from getting the COVID-19 condition from being severe, right? So this is very, very important. So I think today's session is all about vaccines, right? And very important with regard to vaccines, we need to know how do these vaccines work, right? So basically, a lot of people ask, these questions where are these vaccines basically the virus itself? Very correct, very, very correct, right? But we do not put the proper. I mean, we don't take the direct virus and inject it into your body, but it is basically an inactivated form or an attenuated form, or it can be live, but not with COVID-19. Right, it can be a part of that germ or part of that virus injects into you. We inject it into your body, and then your immune system, right? Your immune system will try to recognize what exactly this is, and we'll start an immunity process. Right. So we basically remember that protein spike that I was trying to show you all in the first slide, when I was trying to explain you what is the structure of this particular virus, right? That is the protein spike that is of relevance with regard to the vaccine. So against this protein spike, our immune system will start producing something called antibody, or I like to call police officers of our immune system, right? And these police officers will actually start going around the body trying to look for if there are any other places where they can find this virus, right? This is the whole immunity process in which our body gets immunized. It gets immunized, and later on, if by any chance we do get infected with a SARS-CoV-2 virus, right, our body will quickly be able to recognize and start attacking on that virus. That is how vaccines work, right? We give you a part of it, right? So there are different mechanisms of how vaccines work, but the general idea is that we put a part of that virus into your body, and your body recognizes it, produces an immune process, immune reaction where it produces antibodies, right? And those antibodies will be circulating in your body, and the next time that you do get infected, the antibodies are already produced, and those antibodies will be able to fight the virus, and therefore you will not have a lot of symptoms, or if you do have symptoms, they won't be of severe category. It will be mild or moderate, right? So that is the emphasis of how a vaccine would work, right? So I mean, I told you there are different vaccines that are out there. In Sri Lanka, we have quite a few, right? We have the viral vector, which was the initial method of how we actually introduced. I think a lot of people have got vaccinated, especially in Colombo initially, via the viral vector, which is obviously all of you all know it as Covishield or Oxford AstraZeneca, right? So it is basically a vector. So how they do that is they use an adenovirus, right? They recombinate it, right? It is in a form of a vector. They recombinate it, and they put that particular spike protein on that adenovirus, and then they inject it into our body. The problem with when you look at Oxford AstraZeneca is that you will have a lot of symptoms, right? That shows that there is a immune cascade that is developing. I'm sure a lot of people who have got vaccinated with Covishield will say that the first day, second day, they developed fever, they were having headaches, all of those symptoms, right? That the reason that is of the case is because it was the adenovirus that was actually causing the symptom, right? Then you have the RNA vaccines, which is basically the Pfizer and the Moderna, right? So that you don't inject. That's the interesting part. That you don't inject the virus, but you inject something called an RNA strand, and that RNA codes for a protein that is similar to the COVID spike protein, and therefore your body will start producing antibodies, and it will be a humoral and cellular immunity against that virus. And then later on, if you by any chance get infected, your body will be able to combat that particular virus. Then you have inactivated viruses, that is whole viruses. That is what we have as Sinopharm, right? So Sinopharm is an inactivated virus that they've taken a part of that protein and they inject it, and that is how the immune process works, right? So again, there are different routes in which that they actually how they work, but at the end of the day, the main process is in which you will develop an immunity against COVID-19, right? All vaccines are as, I mean, if you look at statistically, right? I mean, there are a lot of different data that are out there. I mean, I think this is the where you see out here, right? Oxford AstraZeneca. I mean, these are all statistics, right? Don't get a little alarmed. Oxford AstraZeneca has a range of 62 to 90%. Again, the effectiveness increases when you are fully vaccinated. Sinopharm has that. This was an old sort of statistic. I think I took it a month back. So I think it's a little more. It's around 84, 85. Sputnik is at 92. Moderna is at 94.1. Pfizer is at 95%. Right. So these are sort of the effective vaccines that are there, which are approved by the WHO right, and are safe, right? If you look at the doses, right, the reason now some might ask, why do we have 2 doses, whereas there were some vaccines that were just 1 dose? The 1 dose vaccine was, I don't know if you all remember, there was Johnson and Johnson's, which was a Canadian vaccine, which was 1 dose, right, as compared to all the other vaccines where, you know, it's at least 2 doses. So the reason we actually give the second dose is so that we make sure that the body hasn't forgotten the virus, right? So the body, because usually whenever you get an infection, right, whenever you get infected, you produce antibodies against that infection. Now, for example, I think the simplest example is that if you have ever got infected with chickenpox, right, varicella, right, you're never, I mean, you know, you're very unlikely you're going to get infected ever again, unless your immune system reduces and you get something called shingles or varicella zoster. That's a different story. But the point of the matter is that, you know, your immunity will be long term, right? But with these viruses, it is not absolutely, you know, confirmed whether your immunity will be long term. To make sure that, you know, you have a long term immunity, you will have to actually get a booster shot, right? The second shot is usually a booster shot, which actually reminds your body or reminds your immune system such a virus exists, right? So that, you know, so that circulating antibodies will be long-term antibodies, right? Now, we have only gone at the phase where we are administering 2 shots. Yes, the government has agreed on, you know, going for a 3rd shot for frontline workers, right, after 5 months of the second dose, right? Other countries have already gone for 3rd shots. I recently saw an article that Israel is going to go for their 4th shot. Again, it changes from variety, I mean, different medical practicing bodies change according to how they feel fit, right? Is it just a sort of a way where, I mean, the best example would be how we give influenza shots every year, because we identify what are the strains that are predominant, and we update that sort of vaccine in such a way that it would work best with these sort of variants, right? So that's how these vaccines work, right? And I've explained about the vaccine effectiveness. Now, I think this is the most important slide, you know, for today. Why is it important for you to get vaccinated? I think that is very, very important. Firstly, there is a very little chance that you will need an ICU bed or a HDU bed. ICU is, I'm sure you all know, it's an intensive care unit bed or a high dependency unit bed, right? Where you will need either a face mask or you will need oxygen, right? You might need a CPAP, BiPAP. That will completely reduce your chance from being admitted in a hospital in an ICU or an HDU, right? And as you know, our medical facilities, you know, right now we are flooded with so many patients, which is very difficult, right? So vaccinations are helping us because it is reducing it's reducing the severity of the symptom, right? So that is point number 1. And in other words, I would say it will prevent you might get infected, but you won't die, right? So that is very, very significant, right? That is point number 1. Point number 2, another very important point, right, is you will reduce or you will stop the chain of transmission, right? You will stop the chain of transmission when you get vaccinated. And that is what is best explained with something called herd immunity, right? I'm sure you all have heard about this particular concept, right? Herd immunity is if you by any chance are surrounded by people who are actually vaccinated, right? Even if you do get it, you won't give it to someone else. And that is our best next chance, right? So, you know, that is very, very important with regard to, you know, making sure how we look at it in a long-term perspective. Because obviously, right, we need a long-term solution. Getting vaccinated every year is going to be something I don't think is going to be feasible for everyone, right? I mean, there are methods that are being right now researched on, where it can be an oral pill or sort of a nasal spray, vaccines every year. You know, a lot of things are being still under the process of research. But, you know, this is another very important concept. You will take part in herd immunity if you do get vaccinated, which is very, very important because that will stop the chain of transmission, right? Next, you see other countries like, you know, US and all, where, you know, they've got a lot of people vaccinated and, you know, they are saying that, you know, you don't need to wear masks. All of those things will be in the later process, right? But the most important thing at this particular moment, right, is making sure that we do we do our part in making sure everyone gets vaccinated. Right. Another research study, which was very interesting recently that was published, it said that the reason why we have so many variants is because we are allowing the virus to spread from one person to another. Right. When the virus spreads from one person to another, what happens is it increases its potential. Right. It increases its likelihood to mutate and produce a new variant. Right. So if we get everyone vaccinated, we are indirectly reducing this virus's chance of mutating and developing into another variant. So that's another very important aspect of why we need to make sure everyone gets vaccinated, right? So, I mean, I know a lot of you all have these different myths, right? Where I should not get vaccinated because it's like this, right? It isn't safe, right? Remember, even though vaccines take a long time to be developed, it goes through 4 phases of clinical trials, right? I understand that normally clinical trials, the 4th phase takes a few years, right? Where they take around thousands of people. They give half placebo, half vaccine, and then they see the side effects. They do all of that. But in a sort of an emergency right now, we can't actually, the best way to say it is, we can do that. But there will be a lot of collateral damage, and that will mean a lot of lives lost, which is why we have gone in the sense the WHO has allowed, in the basis of an emergency sort of process, in allowing these vaccines to be injected to all, given to everyone in all countries, right? So they are safe, right? As long, I mean, they're still looking at it, we are still looking at it. I mean, whenever there is an adverse reaction, we report it so that we can understand. We are still learning, right? So at this moment, I would still say that all vaccines are safe that are in Sri Lanka, right? All the vaccines, I mean, yes, we have had a few adverse reactions. There have been a lot of reported issues, but when you look at it on a statistical point of view, it would be less than 1%. I mean, not even 1, it will be 0.01% of people who have had these adverse effects, right? So a lot of people say, it changes your DNA. Nothing of that sort, because especially with the RNA vaccine, which is the Pfizer and Moderna, a lot of people say, will it change our DNA? Will it make us different? No, it just changes with regard to a part of your, DNA sequence. It has a very short-term sort of an action to produce the spike protein, right? A lot of people ask me this very interesting question. I got vaccinated 4 or 5 days back, and then I got a cold, and then I actually just did a PCR, and I was positive, right? Does it mean because I got vaccinated was the PCR positive? No, there is no relevance with regard to you being vaccinated and your PCR being positive. That is a completely different scenario, right? It cannot give you COVID-19, right? All these vaccines are not going to give you the disease, but they are going to give you the immunity. They're going to give you the immunity so that your body will be ready to fight the virus when, or hopefully not, if by any chance you do get infected, right? A lot of other reasons where, patients say that it has egg proteins, right? I'm allergic to egg proteins, right? Listen, if you have an allergy, that doesn't mean that you can't get vaccinated. You still can get vaccinated under proper regulations. You can't get vaccinated at these normal places. You have to get vaccinated where you have a ETU set up by any chance you develop an allergy, so that the doctors out there can treat that allergy, right? Say the people say that it causes a lot of side effects. Yes, some of them do, but believe me, facing those side effects are better than going into the ICU and being intubated, catheterized, and doing so many things just to make sure that you stay alive, right? All of those things are treatable. Those side effects are nothing as compared to what lays ahead. A lot of people know, and I think what is very important, what I want to emphasize is I had this person who had told me, he had told me a few months back, Burhani, it's very important that you tell them the significance of what exactly we are going through, because people have not taken it very seriously. And the way he realized it was when he lost his father, right? When the way he lost his father and the way things went ahead, he realized how much of a significance it was to take things very seriously, right? So at that time he was saying, yes, I know people tell us to actually, wear a mask, practice all these safe things, but I never took so much of consideration into it. But after what happened, he realized the importance of it, right? So this is what we are all trying to tell you all is, I mean, I think my whole point of view is so that, you get yourself educated, you make sure you practice what is being told to you, it will make a big difference, right? And lastly, I think it's a very important thing. I think a lot of people tell me, will I, I have, especially now at this moment, we have a lot of, now the government started getting people vaccinated from the ages of 20 to 29. I mean, 20, yeah, 20 upwards. I had a lot of people who had called me and asked me, is it possible? Will my daughter be unable to bear kids? These kind of questions, right? Listen, at the moment, there is no there is no sort of evidence where it has caused infertility or subfertility. Yes, there are different data that are there, a few cases here and there that have said that it does cause subfertility. But listen, subfertility is not something that we haven't treated. We have managed to make sure, we have treated subfertility. We have procedures that are there in play that we can treat them. This COVID-19 is not something, we do not have an answer to this. We do not have an antidote or, an antiviral that works effectively against COVID-19, right? So you always have to outweigh the risk. I mean, and this is not at all a risk, even though a lot of people actually, are thinking about it, right? Right. So my other particular important thing, which I want to tell you, which I've already emphasized, it is absolutely safe, right? Yes, it does have its side effects, but it is safe, right? So you are eligible to get the vaccine. There are different people, a lot of people ask, I have had a heart surgery a few weeks back. Is it possible for me to get vaccinated? I'm a patient who's having diabetes. Is it possible for me to get vaccinated? You guys are the first people who should get vaccinated, because y'all are having the highest risk of developing severe COVID as compared to other people, right, who have no other illnesses, right? So they are the first people who should get vaccinated. If you are having any condition, such as a neurological condition, make sure you speak to your neurologist, or make sure now if you're having a kidney problem, I mean, you're on these drugs that are for your kidney, a sort of kidney issue, speak to your nephrologist before getting vaccinated. Speak to your relevant doctor. He or she will definitely tell you, yes, go ahead, quickly get vaccinated. Right? So that is the importance of, all these other conditions. If you're having all these other conditions, make sure that, you're taking your routine medications, you're taking care of yourself, right? Because those things do matter. Just because you get vaccinated, that's why I wanted to actually, highlight. What I wanted to highlight is, just because you get vaccinated does not mean that you can, say, okay, I'm vaccinated, I'm absolutely all right, nothing is going to happen to me. No, you still have to practice safe. I mean, you still have to have proper respiratory etiquette. You still have to actually make sure that you're wearing your mask wherever you're going outside. Make sure you have clean hands, wash your hands. All of those things are as important as getting vaccinated. It's a simultaneous process that all of us have to do so that we can actually combat this particular problem. That's how important it is, right? So this is a very controversial topic with regard to pregnancy, right? Whether you can get your vaccine. Well, Sri Lanka has loved it, right? But they all, I mean, in pregnancy, they have these different groups, right? So they say that high-risk groups should get vaccinated, right? So always speak to your OBGYN, right? He or she will help you. Basically, he or she will give you a letter saying that, okay, you can go ahead and get the vaccination. So if you want to know a little more, in the US, they emphasize people, I mean, pregnant mothers to get vaccinated in the weeks, in the third trimester. The reason, I think that's another reason. The reason is that the antibodies, if the antibodies that are produced can pass through the placenta into your unborn baby, right? So because of that, they actually emphasize to get vaccinated in the second or third trimester. That is Pfizer and Moderna, according to the United States medical team, right? So that's that. So still, you can just speak to your OBGYN, right? Children, this is another very pressing issue. I mean, at the moment, Sri Lanka hasn't started. So vaccines, all of these vaccines, when we make these vaccines, as I told you, the way I say it's safe, it has been tested, right? So usually the target group is more than 18 years old. So Sinopharm, Covishield, right? Sputnik have been only checked for people who are more than 18 years old. That is why they only allow people who are more than 18 to get vaccinated, right? But Pfizer is something that they've tested for more than 12 years old. So that is why they say more than 12 years old can get vaccinated with Pfizer or Moderna. So the government's plan is to actually, eventually, right? Eventually get the kids as well vaccinated with whatever vaccines that are available and whatever are safe for children, right? And a very important question, a lot of people ask me, I mean, I know a lot of you all will know a lot of people who have got infected or people who have got sort of a cold or a cough, and they lock, I mean, they quarantine themselves, but they don't get tested. I'm sure you all also know a lot of people, and right, they ask, okay, what if I had COVID-19, I got infected with, am I allowed to get my vaccine? Yes, you are allowed to get your vaccine, right? The process is simple, because, I mean, the reason as to why we do it is because you got infected, you develop symptoms, right? Sometimes you didn't develop a lot of symptoms. So that means, the viral load wouldn't have been as significant, right? And therefore your body wouldn't have been able to produce antibodies properly. It would have produced, but, they wouldn't actually live up to the long-term sort of immunity, which I was emphasizing on earlier, right? So you getting yourself vaccinated, right? It's going to you're anyway going to get that weakened portion. And it is going to basically, sort of boost your immune system in producing more antibodies so that your immune process or immune status with regard to COVID-19 will be as long-term as possible, right? So the duration that we normally say is after recovery. After recovery of whatever infection that you had, 14 days after that particular point, you can get your COVID shot, right? So that's how, that is the normal process in which we actually, get people, even people who actually are in the ICUs, HDUs, when they are leaving, one of our discharge plan is to actually make sure that, okay, you've now got vaccinated, so make sure that you go on this particular day and get yourself vaccinated, right? So that is all what you need to know about vaccine. This topic is something that keeps evolving day and day. I mean, every time, whatever you read, there's always something new. I mean, as compared to what we knew back in 2020, right? Things have evolved. We did not even think that there will be vaccines. There are vaccines, and these vaccines are absolutely effective, right? So my whole point of, taking my time and coming here is to emphasize on the importance of you getting the vaccine, because it definitely saves lives. So make sure you get yourselves vaccinated. Thank you very, very much.
Thank you, Dr. Burhanuddin, for your informative speech. Next, we have with us multiple Paul Harris Fellow, Rotarian Dr. Rohantha and He is an award-winning Sri Lankan professional who has also served the United Nations. He has been honored among the 6 members across the world as People of Action, Champions of Health by Rotary International. He is the director of the project Stop the Spread, which was picked to be a national project for the year 2020-2021 by Governor of Rotary Sri Lanka and Maldives, Ajit Veerasinghe. The award was in recognition of their proactive behavior demonstrated to improve the foundation of good health at home and across the globe. The floor is all yours, sir. Sorry, Dr. Rohantha is unable to speak right now. We will continue with our next speaker. Past District Governor, Rotarian Dushan Soza. He has been in Rotary for 36 years and was elected as governor for the years 2018-2019. He was the chairman of Project Stop the Spread. The project has reached 1.5 million households, with almost 25% of the households in Sri Lanka being reached via 5,800 interactors, 7,000 Rotaractors, and 2,000 Rotarians. Separately, there are almost 300 companies who have been certified as COVID control environments by the Sri Lanka Standards Institute. Over to you, sir.
Hi, good evening to all of you. I'm Dushan. Thank you very much for that introduction. And I like those brief introductions. So basically, I'm coming into this call pretty cold, because cold not with virus or something, but cold meaning that I wasn't aware of this session, and I really didn't know what was expected from me in this session as a speaker. Because your main speaker was excellent. I thought it's one of the best presentations I have listened to on the subject. Very educative, very well presented, easy to understand, crisp and clear. So I thank Dr. Is it Burhani? No, I couldn't catch the name properly when I logged in. For is he still on the call? Hello.
No, Rotarian.
He is dropped off, is it? Because I have a question to him as well. Okay, so
Yes,
no.
go on. Yes, go on. I'm sorry. I was on another call. Yes, go on.
Yeah. Hi. Good evening, Dr.
Hi.
Name is Dushan Soza. I just wanted to first clarify two questions, because not every day do we come across speakers like you with your knowledge and the clarity in which you spoke. These two questions have been bugging me for some time, and there's never been a clear answer given anywhere in the media or anything. So the first question is that you were talking about the vaccine so clearly. Now, with the AstraZeneca, the first dose that was given somewhere in February, and for a group of over 60s, the second dose was given after 20 weeks, and I'm one of the victims, right? So, according to what you mentioned today in your presentation, 20 weeks is really is like a new dose, and it will not act as a.
This is very. I actually did not mention this, right? So normally, what
no medical authority, not the ministers, nobody ever mentions it. They're talking about boosters, they're talking about over 60s, but nobody's addressing this group of people, which is numbering over 650,000 over 60s, who have been cheated out of this vaccine because they were given a vaccine, and then obviously for good reasons or whatever reasons, the vaccine went dry and they didn't have a supply. And when the supply came, it was after 5 months. So after 5 months, you give a second dose, and people are going to sleep on that subject. So at least somebody must wake up and say, hey guys, in our booster, this group of people would be priority, and they should come in, because that second dose really is like the first dose now. And if you're looking at a booster, this is the best group of people you can even experiment the booster on, because the second dose are given so far away, versus everybody else whose second dose would have come within those acceptable time frame. So my question number one is, why is nobody addressing it? Nobody has addressed this group of people. Second is to get your professional opinion as to what should be done. Now, it's very important, because nobody seems to have learned the lessons in the medical fraternity or any other fraternity. I'm sorry to say that, even with this case, because if you learn the lessons, you won't allow the Sputnik. Currently, there is an issue with the Sputnik 5, same story. They don't have a second vaccine, and the same thing is going to happen to those poor people. So therefore, you want to learn lessons, address this properly, tell the public who are in that group, selected group, because I mean, nearly 1 million people is a lot of people who are out there who are under this cloud of the first, second, and third, and that's it. So that's my question, Doctor. My first question.
Firstly, I do not want to get into the politics of what exactly has happened. My whole ideology is that I'll treat as many patients that I get. I mean, yes, it is very important. These are important things that the authorities have to consider, right? But let me tell you a very funny thing, right? With regard to Oxford AstraZeneca, right? Oxford AstraZeneca is the only vaccine where, I'm sure they've done a lot of different researchers, because now, as you said, there were a lot of people who did not get their shot by the end of 12 weeks, which was when they were supposed to get the vaccine. I mean, the second dose, right? So we have done research with regard to their immune reaction as compared to people who have got their shot in the 5th month, that is 16th week, 20th week, 24th week. So you come in the category of the 20th week, if I'm not mistaken, right?
Absolutely.
So we have found out people who got vaccinated in the 24th week, right, have a more robust immunity as compared to me who got vaccinated by the end of the 12th. The way that it is confirmed would be serologically, where we check your antibodies, now, which is the whole process. We are making antibodies. And they saw that the titer for the titer of the antibodies that are there in a person who got his second booster late is more, I mean, compared to someone who got his early booster, right? So I don't know if it's a blessing in disguise, but don't be worried, right? So that is all I can tell you statistically. With regard to what can be done in the future, yes, I think, again, I think the authorities have to learn on, properly prioritizing the ones who are in the category of high risk, especially like the way you said, more than 65 years old. And they are the ones who are, if we do go into the process of, getting the third booster, right? If we do go into that process, I think that we need to understand, because look, I look at it from this point of view. If you have got your shot, or if people who are more than 65 have got their shot, it becomes less tedious for us when we are working in an MICU, because it's less number of patients, it's less complications, right? So that is why I am here emphasizing on how important these vaccines are, because these vaccines indirectly make my life better. It makes it very less difficult for me to tell patients' relatives that I'm sorry, we can't do much. So it is very sad at the moment at Kaluboville also. It is very sad. We are losing so many patients, right? The sad part is that we are losing patients not because we can't do anything about it, because no one else is there for them. If you look at a family, I mean, these are issues. We're not talking about vaccines. When you take a person who gets infected, what do? We put him to the hospital. What happens to his relatives who can take care of it? They are quarantined. They're somewhere else, right? I have patients who have no one, right? And there are attendants, but we have wards of around 40, 45. All attendants can't look after all of these patients. So I still remember when I do my ward round, maybe at around 2 p.m., all that patient has had for the whole day is just a morning coffee or a morning tea. So if that patient is not eating well, how is this person's immune system going to fight this particular thing? So these are basic things, so these are issues that are there. But let's just hope, that is why I emphasize about vaccines, because at least then I hope the number of patients that will have to get admitted at hospitals will reduce. And therefore, we will be able to, treat those other patients who, have got vaccinated, who still haven't, managed to, make it through. We can treat them better. Right. So that is why, I want to, say that make sure that you all are taking necessary precautions. You all are practicing social safe distancing. And look at, this quarantine doesn't look like a quarantine. Right. So, these are things that we need to understand. As long as people are actually taking these necessary things seriously, we won't have to worry. I think that's all that I have to say. I hope I have answered your question.
Second quick question and last question. The PCR machines, are they designed to test for COVID in particular, or is it a all-purpose machine which, for example, if you go with a flu and you test it, you become positive, or you have dengue and test it, you become positive, or is it specifically for COVID virus?
Okay, so okay, answering your question in short, the PCR machine is specific towards COVID, right? It is absolutely specific. The PCR has a very, very high specificity, right? So it's specifically, if a PCR comes positive, unless, there have been some sort of an issue, but the machine will read an error. I'm sure if by any chance, I know a lot of patients who would say that I called, they said that they need a few more hours to process because they're not sure, so that they're putting it back into the machine. So the specificity is very high. So if a PCR comes positive, it is highly possible that this person is having COVID-19. That being said, you have these RAT kits, the random antigen test kits, right? Those things that take around 30 minutes. Just because your random antigen test is negative does not mean that you're COVID-free, right? I have had so many patients, because now as a general notion, anyone who comes with a cough or a sore throat, with fever, in the ETU, we do a random antigen test and then decide where this patient should be placed, right? So sometimes we have had patients whose random antigen test is negative, but then later when we do a PCR, they become positive, right? So that is something else, but PCR specifically looks for COVID, and it cannot tell what variant it is. It cannot tell any of that, but it will definitely tell this value, which not a lot of people look at. I'm sure if you look at a report, there is something called a CT value. right? It's a counter traction value that tells us how many times the machine has spun to determine if there was a COVID or not. So if the number is less, it means you're highly infectious, right? So we say if it's less than 35 is positive. So there are now the new guidelines say if you are PCR positive, no symptoms, and if your CT value is between 30 to 35, obviously if it's less than 35, you become positive. You don't even need to actually quarantine yourself, right? You can still go ahead. So it might be, something that you're recovering from, right? So that is how RT-PCR.
Thank you very much, Doctor.
You're very welcome.
Thanks. Very useful. So if I may just continue with the interactors. So my view is that first of all, we as human beings, Rotarians, interactors, Rotaractors, whoever it may be, in this current scenario, we should look after ourselves first. Because if you don't look after ourselves first, it's not going to be possible to look after anybody else. It's like when you're flying in an aircraft, and if your aircraft suddenly hits a air pocket or it dives or whatever, the oxygen masks fall from the top. And when the oxygen mask comes down, they tell you first, you put the mask yourself and then attend to your children or the younger people or the older people around you. So this is a similar scenario from where we are coming from. Although in our that will apply to general day-to-day life. But in extraordinary circumstances like what we are faced now, I think first we got to save ourselves before we go saving others. And the biggest message I think I can see from sessions such as these which you have carried out today is the knowledge you are going to gain of this virus, the vaccines, the testing mechanism, and getting knowledgeable speakers like Doctor who came and spoke to us today will actually educate you more than anybody else on the street, more than anybody else on the road, more than anybody else anywhere else. And that's the beauty of being an interactor, because as an interactor, you have the muscle of a group of like-minded interactors to go and attract speakers of this caliber who will come and teach you or tell you exactly what this is all about. So for me, personally, as a district governor coming into this session, which you have organized, for me, the biggest takeaway is that the takeaway of knowledge, which we can go and apply elsewhere. And there was a whole heap of knowledge, very useful, relevant knowledge, which is a huge takeaway from sessions like this. So I congratulate the interactors who organize such sessions, and I hope that you also see it the same way that I'm saying. Just a few things about the projects that Rotary has carried out, of which I was chairman of. We carried the Stop the Spread program, but you could argue whether those programs are successful or not, because end of the day, whether whoever we are, whatever we do must have an impact. So if that was successful, why did COVID spread like this? I know all of us as a group can't be the solution to everything that happens, but we can try and clear clusters and educate those people along, which has happened very effectively. Wear the mask. You now have a really good program in I pledge to wear the mask. I pledge to take the vaccine. I pledge to do this. It's a fabulous concept that you're going through with as interactors. So beyond that point, we Rotarians, when we sat down and thought out strategically what is it we can do, we came up with this concept that at least at the time that we did this, we were in a lockdown, that is the first lockdown, and then people are going to come to work. Now, how will people come to work without knowing what the work environment is all about? So that time we germed a project called the certification program, where those companies can apply for a certification from the Sri Lanka Standards Institution, which is the certifying body, national body, which is recognized for a certification saying my workplace is COVID managed. We are running a process here that manages the spread of COVID, that manages the early detection of an employee who may be coming by public transport or whatever, of his temperature or potential to become a patient and infecting others. So they are preventing that whole thing happening by having a process laid out, which has been defined by the Sri Lanka Standards Institution. It's like in companies, you're running programs called 5S, you're running programs called ISO, which is a standards program that you run. So it's telling everybody else outside that my company, we are running a certain process which is acceptable worldwide. So similarly, on the same concept, when a third party comes and certifies your company and says, this company is COVID certified or COVID managed, that gives confidence to people to come to work, and also gives confidence for your customers to deal with you, because there is a comfort factor built in that some third party recognized body has come and said your home is safe to come, right? Because you follow a process, and therefore your home is well managed to manage this COVID. So with that, I will close my session unless you have something specific to ask me. I'm sorry I was not ready for this, because I was just given a call 5 minutes back saying that whether I can come on this. So I've just come as is, just like this. But anyway, it's a pleasure always to interact with interactors. There's a future of not only our Rotary movement, but future of our country. There's so much potential amongst you young people. In fact, I was very happy yesterday. I was watching news, and where they were vaccinating that 20 years to 30 years group of young children, young people, and the orderly manner in which they were standing in the queue, coming and taking the vaccine. So much so that one of the officials made a public statement on TV saying it was a pleasure dealing with the younger generation compared to my generation, where the chaos all over the place wherever we went to get our vaccine. But you guys were so methodical, lined up in a queue, going one by one, taking your turn, seated, and it looked a different world altogether, those vaccination centers. So there's a lot you can do to change those mindsets. There's a lot you can do to create a new country for us to live in. And there is so much potential. I remember when I was your age, people used to tell me that, but I never understood what these guys are talking about. Right? Only when I grow up, I realized the potential the young people have, provided the youngsters like yourselves follow a process in your own life, have some aspirations in your own life, and and have interest in working in groups, social groups, and so on, which is very vital to your upliftment and building of your character. And I congratulated all the interactors today for setting up this session, and I see about 90 odd participants, and for the success of this program. Thank you very much for inviting me. May God bless you all and keep you all safe.
Thank you, Past District Governor Rotarian Dushan Soza, for your illuminative words. We now have multiple Paul Harris Fellow Rotarian Dr. Rohantha and here with us. Here, he is an award-winning Sri Lankan professional who has also served the United Nations. He has been honored among the 6 members across the world as People of Action, Champions of Health by Rotary International. He is the director of the project Stop the Spread, which was picked to be a national project for the year 2020-2021 by Governor of Rotary Sri Lanka and Maldives, Ajit Veerasinghe. The award was in recognition of their proactive behavior demonstrated to improve the foundation of good health at home and across the globe. The floor is all yours, sir.
Thank you very much. And it's actually a pleasure to meet you all once again. I really like to take permission from the president of the Interact Club, the chairman of Interact, past district governor, and strategic planning head in Rotary International, Dushan Soza. And I think we had a fantastic oration by a very eminent doctor. I'm so glad to see so much of talent in Sri Lanka. Thank you very much. I'm not going to talk about COVID because y'all have had so much of COVID. But all I know is that if I meet you in another 3 to 4 months' time, I'm sure that we don't have to be sitting in front of a computer. I'm sure that we could enjoy ourselves, talk to each other face to face, and we will have a fantastic camaraderie meeting each other. I'm sure of that. That's something that I think all of us must aspire that we will have one day within the next 3 to 4 months. Dr. Nilika says that it's going to be mid-October. I'm giving even up till the mid-November for this, and it was just like this in UK, where we had almost like 5,000 deaths daily. But today, I mean, everybody goes to soccer, everybody goes and watch tennis, and they don't even wear a mask. So I know that we will also come to that, even though things are very rough today. Uh, Another point that I would like to make is that when I look at y'all as youngsters, what really dawned on me when PDG Dushan talked about how orderly that y'all went and got your vaccination in. This is something that I have seen for the last 1.5 years with Interact. I mean, we know that the politicians have basically let us down. It's been absolute disaster of policy decision making, starting from the agriculture fertilizer subsidy, the manner in which the sugar issue happened, where 584,000 metric tons of sugar has been brought in between October and July, which means you have enough sugar for the next 6 months, 16 months. And then subsequently, people are hoarding. And why is it that such a country, small country like Sri Lanka, we can't identify these people? So there's no leadership when it comes to the political, with a lot of responsibility. I say this. We have very little responsibility when it comes to the media. The kind of reporting that happens by different media for different reasons. But when I look at the youth, when I look at the interactors and the road tractors, I'm telling you, I'm really, really hopeful of a fantastic Sri Lanka. And when today PDG Dushan said um, that doctors are talking so good of the manner in which you all were going and putting your vaccination, I'm telling you, this morning I went to Vihara Mahadevi. I went there and watched. There's no point in us talking about stop the spread if you're not going to go on the ground and understand what's happening. And it was absolutely orderly. The way they went in order, how they put their names into that application when the vaccination card was given, how they went and put the vaccine, how they got themselves vaccinated, and how they moved out and then sat for 20 minutes. Nobody was checking them, and how in an orderly manner they went back. So I'm telling you, Sri Lanka's future is the youth. And I'm so happy that you all have become part of this great movement called Interact, which actually, whenever I get invited to, at whatever time, I will always stop the car even under a tree and listen to you, because you all are so strong in what you do. You all are fearless. Yeah, you all are very entrepreneurial. You all are very creative, and it's a lesson for us who sit in the boardroom in the private sector. So I wish you all the very best. Please stay safe, and please remember that Sri Lanka needs you. Thank you very much.
Thank you very much, Multiple Paul Harris Fellow Rotarian Dr. Rohantha for your enlightening speech. I would now like to call Interactor Insia Imran to give the vote of thanks.
Thank you, Interactor Amatullah. It's my privilege to have been asked to propose the vote of thanks on this occasion. Firstly, I would like to thank His Holiness Dr. Sayyidina Mufaddal Saifuddin for his advice and guidance to take proper measures against COVID-19 and get vaccinated as soon as possible. On behalf of the Committee of Project Apart Together and the Board of Officials of Interact Club of Burhani Serendib School, I would like to convey my heartiest thank you towards the guest speakers, multiple Paul Harris Fellow Rotarian Dr. Rohantha and past District Governor Rotarian Dushan Soza and Dr. Burhani Hamza, who took time from the busy schedule to speak at our event and educate on our guidance on this very important topic. In addition, I would like to take this opportunity to convey our heartfelt gratitude to all the dignitaries present here today. Our principal, Dr. Sheikh Shabir Hussain, and our staff advisor, Ms. Rashida Hussain, for their constant support in organizing this event. Finally, a thank you goes out to all our audience for the day. The session would have not been a success without your presence. In conclusion, I hope Allah grants our beloved Mola a long and healthy life until the day of judgment. Ameen. Thank you and stay safe.